Hello, thank you for joining us for the Rochester General Hospital Total Hip and Knee Replacement Preoperative Teaching Class. I hope that you find this presentation helpful. If you have any questions at the end, I will provide an email and a phone number for you to contact me. During this presentation, I will introduce you to our program. We will discuss preparing for surgery, your hospital stay, and being ready when it's time to leave the hospital.
Our mission at Rochester General Hospital is to enhance lives and preserve health by enabling access to a comprehensive, fully integrated network of the highest quality and most affordable care, delivered with kindness, integrity, and respect. Our values at Rochester General Hospital are quality, respect, foresight, compassion, and collaboration. We hope you see these values throughout your stay at our hospital.
My name is Rachel Wakefield. I am the Orthopedic Program Manager here at Rochester General Hospital. I am a nurse, and I have been a nurse in the operating room for about 4 years and have recently moved into this role as the Program Manager. My job is to oversee the joint replacement program here. I also teach the classes. I am an advocate for you and your family while you're here at the hospital. I also participate in interdisciplinary rounds every day where we talk about you and your stay and your plan while you're at the hospital and as you move on and go home. You will see me while you're here at the hospital, and I'm available to you at any point. Here at Rochester General Hospital, we are certified by the Joint Commission. The Joint Commission is a governing body that makes sure all of the hospitals are in compliance with national standards, patient safety, and outcomes. They certified us in 2010 as a joint replacement center, again in 2012, 2014, and 2016. In 2018, we applied for the advanced certification for total hip and total knee replacements, and we got that certification. We also are up again for our recertification this year. While you are applying for the certification, the Joint Commission comes and does a survey here, so you may see them while you were here for your surgery. In 2018, we also earned our Blue Cross Blue Shield distinction, which just gives you better quality providers and better quality care. Our joint replacement program here at Rochester General Hospital continues to provide education throughout the entire process of your surgery. So we offer our joint replacement classes, which are held weekly. We also give you a joint replacement guidebook, which is a great resource. It's full of helpful information, checklists, and exercises. We ask you to read this thoroughly. We also ask you to bring this with you to appointments, your stay at the hospital. You can write down notes. It is a very helpful guide. Another thing that we offer here at Rochester General is Emmy videos. These videos are free animated educational videos on the surgery that you are scheduled to have. They are animated, so there's no bloody, gross pictures to see. It just kind of gives you the process of the surgery. The code for the Emmy videos is sent to your MyCare account. If you do not have MyCare account, it will be sent to an email, or they can even call you and give you your access code. Sometime in the next few weeks before your surgery, you will receive this information. Emmy also does post-op phone calls. This is just so that we can gather information about your surgery and your education. One of the requirements for being an advanced certified total hip and knee replacement center by the Joint Commission is that we are involved with the American Joint Replacement Registry. This registry collects data for improving joint replacement programs across the country. They conduct surveys preoperatively, 3 months, and at 1 year. They take this data and help see where you started and where you've progressed to. At Rochester General Hospital, we have a center for joint replacements. This is 6800. This is the 6th floor of the main hospital. So we are your orthopedic specialists. Your team includes your surgeon, your anesthesiologist, physician's assistants, myself, the program manager, our nurse manager, clinical nurse specialists, care managers, physical therapists, occupational therapists, social workers, nurses, LPNs, patient care techs, and everybody else that's involved with your care. We are all trained and have specific orthopedic education to care for you. So why do you need your joint replaced? There are two likely reasons. Number one, you've been living with joint pain for quite some time. And number two, your quality of life has been altered. So what we're going to do for you is we're going to take out damaged parts of your joint and replace them with artificial parts. Any arthritis that you have will now be gone, your pain will be less, and your function will improve with time. So here we have two different knees. On the left is a normal, healthy knee. As you can see, there is good space between the top and the bottom, which is the cartilage. This knee is probably of a healthy 20-year-old person. The knee on the right is an arthritic knee. The cartilage is gone, bone is rubbing against bone. This person is dealing with pain every day, movement, bending, walking, anything, where you are today and why you need a knee replacement. This is a total knee replacement knee. As you can see, the old bone is gone, the arthritis is gone, and is replaced with hardware. In the middle, there's space, which is a plastic insert which acts as cartilage for smooth movement. No more arthritis. Here we have two different hips. On the left is a normal, healthy hip. There is space in between the joint, which allows for smooth movement. Again, this is a younger, healthier person. On the right is an arthritic hip. There's not a lot of space. You can see all the white light area, which is arthritis, bone rubbing against bone. Lots of pain, everyday movements, a lot of uncomfortable positioning. This is a total hip replacement. As you can see, we've taken out the old bone and replaced it with hardware. Up in the socket on the top is a smooth plastic piece inside of that metal shell, which allows for smooth and easy movement.
Preparing for surgery has three important steps. Number one being self-optimization. This is key in having a good recovery. We'll go into detail on the next slide. Second, we'll talk about pre-admission testing. And third, we'll talk about preparing your home.
Self-optimization is making sure that you are at your optimum health before surgery. So this includes your weight management, making sure you're medically healthy for surgery, and nutritionally healthy for surgery. We'll talk in detail about nutritional optimization later, and exercises we're going to talk about throughout the entire presentation, but in your guidebook, they are located in pages 15 and 18. We suggest that you start these exercises now so that you can just get yourself going and prepared for what to expect. And if you are a smoker, we also suggest that you quit smoking. Smoking is terrible for your health. It also does not help with bone growth and bone healing and wound healing. So it's something to consider before surgery. Nutritional optimization is something that is very important before surgery. You can't tell by looking at someone if they're nutritionally healthy or not, and this is just something you can do for yourself to have a better outcome after surgery. So this drink is the Nestle Impact Advanced Recovery Immunonutrition drink. It is formulated to help support your body's nutritional needs before and after major surgery. At RGH, this is something that we consider best practice. It's recommended for you to do this. It is not a hard stop if you do not. So if you have the ability to get the drink, we do suggest that you do it. So you'll drink this 3 times a day for 5 days before surgery, and again when you get home after surgery, 3 times a day for 5 days. This drink helps with wound healing and inflammation. So if you can do this for yourself to have a better outcome, why not? It is available at our apothecary here at RGH as well as Unity's apothecary for a total of $64 for the 10-day supply. It's available on Amazon and the Nestle websites for an increased charge. We do sell it at cost here at our hospital, so keep that in mind. One of the things that we ask as well is for you to drink Gatorade before surgery, the day before. This just helps kind of give you a few extra carbohydrates, gets you hydrated before surgery, and it's another best practice.
During our current COVID-19 pandemic, our pre-op testing has changed. So your pre-op appointments will be conducted over the phone with our pre-op nurses. They will discuss your current and past health histories. They will go over your current medications with you. So please have a list of your medications available during this phone call. They will discuss diet restrictions with you so you know what to eat and what not to eat before surgery. And they'll also discuss with you your skin prep that is required for joint replacement surgery. These wipes are available through your physician's office and should be arranged by your physician's office. Certain paperwork is requested that you have with you for surgery, and these are your advance directives. So located in the guidebook under the checklist, resource, and forms section, you'll find some blank forms that you can use to fill out. If you have a healthcare proxy or living will already made, please bring copies with you to the hospital. And we do ask that you have this all filled out with you before you come for surgery. If you don't have the guidebook, forms are also available online at Rochester Regional Health, Patient Policies and Forms. So what to pack? So we ask that you bring your own clothes with you to change into after surgery so that you can be the most comfortable. Whether that's loose fitting pants, a nightgown, or a pair of shorts, we want you to be comfortable. You're going to be doing exercises in a gym with other people, so just make sure it's modest and that you can move freely. You're welcome to bring your own toiletries as well, but we do provide some here at the hospital. Don't overpack because you're not going to be here very long, 1 or 2 nights max, and try not to bring anything of value just in case of any misplaced items. During this COVID-19 pandemic, our discharges are working a little bit differently as well. So we really just want all of our total joint replacements to start healthy and stay healthy. So during this time, we want patients to return home to be as safe as possible. So we really are only utilizing our skilled nursing facilities and rehab facilities as a necessity. We don't want to send our patients there unless it is an absolute need. So please be prepared for just a one-night stay in the hospital and having nursing services and physical therapy to meet you at home after discharge.
Part of preparing for surgery is figuring out what's going to happen after for your discharge planning. Are you going to go home or are you going to rehab? Keep in mind that most of you should be able to go right home. If you're healthy enough for an elective joint replacement surgery, you should be healthy enough to go home. Rehab is a necessity and not a want. But we do want you to be aware that it's a possibility. So we'd like you to look through our list of facilities. They are in your guidebook. Check with your insurance, call or visit the facilities just to have a better idea of what's available for you. Social work is also available for you if you have any questions before surgery. Social work is listed in the RGH section of the guidebook. So 1 week before surgery, we ask you to do a few things. There is a checklist in the back of the guidebook, so we ask you to throw that on your refrigerator to kind of keep up with what needs to get done and when. If you're going to drink the Impact Nutritional Supplement drink, that's 5 days before surgery. We also want you to do the chlorhexidine scrubs the night before surgery. These will be provided to you by patient testing. We would like you to drink the Gatorade the day before surgery. No eating or drinking after midnight, and take any medications as directed from the nurses at patient testing.
Preparing your home is essential for having an easy recovery. And now is the time for you to get your house ready for your return. So take this time to install some grab bars in the shower or in the bathroom. Remove clutter and small area rugs that could be tripping hazards. Rearrange furniture for easy sleeping arrangements on the couch or a bedroom on the main floor. Cook some meals in advance so you don't have to cook for yourself during the first few weeks. And this is the time to ask for help from friends and neighbors, whether it would be with grocery shopping or caring for your pets. Now's the time to get ready.
For your day of surgery, we ask that you arrive 2 hours before your scheduled time. If you come in the main entrance of the hospital, you'll go straight ahead to the gray elevators and take them to the second floor. There is a receptionist there who will check you in. They will then take you to your assigned room with a nurse. They'll have you change into a gown. They'll take your vitals and start an IV, give you compression stockings. We do ask you not have jewelry, makeup on, and have your dentures taken out as well.
Once you are ready for surgery, you will meet your surgeon. You will also meet your anesthesiologist and your operating room nurse. During this time, the surgeon will mark the surgical site and you will go over choices of anesthesia. Rochester General Hospital has enforced some restrictions on visitors during this time, so please be prepared to talk with family through your cell phone or a landline provided by the hospital in your room. There are also iPads available to be able to stay in contact with family through FaceTime or for talking, and the family will also be contacted by the staff with updates throughout your stay.
So I want to talk to you about anesthesia choices. There are 2 choices for anesthesia: general anesthesia and spinal anesthesia. General anesthesia is a combination of gases and IV medications. You are in a deep sleep and unable to feel pain. Spinal anesthesia is a local anesthetic injected into your lower back, causing numbness from the waist down. This is performed under sedation. It is also the recommended type of anesthesia for total hip replacements and total knee replacements. It is very safe, and there are a lot of advantages to spinal anesthesia over general anesthesia. Some advantages are less blood loss, you have less nausea when you wake up, you are less drowsy when you wake up, there's improved pain control, and reduced risk of serious medical complications. Making the choice for which anesthesia to have is a team effort. We'll talk with your surgeon, your anesthesiologist, and you to come up with the best choice. We'll take a look at your general health and physical condition and what past experiences you may have. One thing we offer for total knee replacements is a nerve block. This is where we inject local anesthetic into the thigh and behind the knee, which provides numbness to the front and back of the knee for post-operative pain control. This is performed by an anesthesiologist with an ultrasound and under sedation. The nerve blocks can last anywhere between 12 and 24 hours and provide wonderful pain relief for after surgery. After surgery, you'll be transferred to the post-anesthesia care unit, also called the PACU. Here, you'll be monitored closely by nurses. They will help manage pain and nausea if you have it. Once you're stable, you'll be transferred to 6800, our orthopedic floor. You will meet your nurse. They'll take your vitals. They'll help deal with any pain you're having. They'll talk about elimination, transferring your diet, and activity while you're on the floor. Pain management. Pain management is started before surgery in DOSA. It's managed throughout surgery and into PACU. Pain is assessed throughout your entire stay at the hospital. What we want you to know is pain is expected, but it should be manageable. So we want you to work with your nurse to create a plan for pain control. What is good for you might not be good for someone else, and vice versa. So we rate pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst imaginable pain. So create a good place for you to stay in a range of 0 to 10 with your nurse so that we can help keep your pain controlled. There are a few ways that we help prevent infection. One of the ways is by IV antibiotics. You will be given 1 dose before surgery and 2 doses after surgery through your IV. We also use a special dressing called an Aquacel dressing. Most of your surgeons use this. It's a waterproof dressing that seals your incision in to help prevent infection. That'll stay on until your home care nurse removes it. We don't usually use drains on our knees anymore, and that is another thing that we do to help prevent infection. We also want to talk about blood clot prevention. So there are a few ways that we help to prevent these. Number 1 is by exercises. We want you to go through the book to look at the exercises that are recommended. We also want you to do ankle pumps and thigh and butt squeezes whenever you're stationary. We use compression stockings. We also use sequential compression sleeves while you are in bed and during surgery. We also practice early mobilization here at the hospital, so everyone will be getting out of bed on the day of surgery, and everyone will also be on some type of anticoagulation therapy. So everyone will be on some type of anticoagulation. Your surgeon will decide what is best for you and how long you'll need to be on it. You will be given specific instructions on any new medications at discharge. There are also some foods and drinks that may affect the way the medications work, so we want you to be very honest and open about all the medications you are taking before surgery. Everybody will be getting out of bed on the day of surgery. This is huge for total hip and knee replacements. Early mobility is proven to have better outcomes, less blood clots as well. So we want you to be your own advocate and make sure you get out of bed on the day of surgery. Physical therapy will come and evaluate at the bedside. And we also want you to know that everyone is a fall risk. So you will have bed alarms and chair alarms, and we want you to call before you fall. Make sure you use your call light before you get out of bed. Physical therapy is done twice a day in the gym, in the morning and the afternoon. It is recommended that a family member or coach comes with you to the session. We do group therapy, so all of our joint replacements will go down together. Our physical therapist will assess you and they'll talk about bed transfers and walking, strength, and range of motion. So there are some certain specific things for knees and hips that I want to talk about. For knees, you're going to use a rolling walker. You will have a rolling walker provided for you before you leave the hospital and while you're here at the hospital. We want to talk about pillow placement as well. So we don't want anything under the back of your knee. Pillows are to be at your ankle. We also provide you with an ice wrap for our knee replacements, and this is to be worn 24 hours a day. While you're here, this also goes home with you, and we recommend that ice be on your knee until all of your swelling has gone down. For our hips, we want to talk about dislocation precautions. Though these are in your guidebook, we really want you to know them and learn them and really understand them. So we don't want you to bring your leg out or in too far. We don't want you to bend greater than 90 degrees. There's no crossing your legs at all for a hip replacement. You will also be seen by occupational therapy while you're here, just so that you can learn how to do activities of daily living over again. So how to put your shoes on, how to put your socks on, all those types of things. So there is some adaptive equipment that we recommend. For our hip replacements, occupational therapy will come and see you to teach you your daily activities. There are some special equipment to help maintain your precautions for the 12 weeks that you may have them. So those hip kits are available at Amazon and some supply stores. They include a sock downer, a long sponge, a dressing hook, a long grabber, and a long shoehorn. And these are just things to help you maintain your hip precautions after surgery. Something to think about for our hip replacement patients as well are car transfers. Some car seats may be too low or too high, so we want you to just keep that in mind before getting in and out. One of the things that is recommended is maybe a thick pillow to sit on if that car seat may be too high or too low. So just keep your hip dislocation precautions in mind. So one thing we do ask you to do before surgery is to see how many stairs that you have at home. How many do you have? How high are they? Are there railings around? We want to be able to know what you have at home and what to expect so that we can practice those in the gym with your physical therapist. Again, our exercises are very important. So review these exercises in your guidebook. There are separate exercises for knee replacements and for hip replacements. So do those exercises before surgery so that you can be an expert after. You can leave the hospital when your doctor says you are ready, when physical therapy and occupational therapy have cleared you, and when your pain is manageable. On average, our hip and knee replacement patients are going home the next day, so anticipate a day 1 post-op discharge. While you are in the hospital, a home care coordinator will come and meet you. They will order any equipment that you may need and order home care services, so a nurse to come to your house after surgery, if occupational therapy is required, physical therapy, and any blood draws that you may need. These will all be set up for you before you leave the hospital. Lifetime Home Care is Rochester General's home care agency of choice. We sign everyone up for Lifetime unless you have a preference with a different provider. There is Home Care of Rochester and Visiting Nurse Services. If you have a preference or if your insurance contracts with someone else, we can always set that up for you. Upon discharge from the hospital, please have a ride set up for you. Again, you may be going home after one day, so have a ride available as early as that one day. We will give you clear instructions at the time of discharge about managing your wound, any activities that you may need to do, any new prescriptions that you have, and when your follow-up appointment is. So if you need rehab, insurance first must approve rehab for you. The facility of choice must have a bed available. Most insurance companies do require a 3-night stay in the hospital before you can go to a rehab facility, so keep that in mind. Usually we'll let you know where you're going by the second day that you're here. And you will see a home care coordinator before you leave our hospital to make sure you have home care set up for you when you do get home. So when considering rehab, we do want you to choose 3 facilities from the list in the guidebook. We'll let you know what openings we have found for you, and we do provide transportation. There are no long-term benefits for rehab, so we want you to remember that. You will get nursing and physical therapy at home just as you would at rehab. So life after a joint replacement, we really want you to continue your exercises for a minimum of 12 weeks, even though lifelong exercising is best. For our knee replacements, we ask you use ice regularly for swelling and pain relief. We want you to use your primary care physician and your orthopedic surgeon to maintain your optimal health. And keep in mind that when you have any medical or dental work, you may need prophylactic antibiotics. So if you have any questions, call your doctor or tell them first that you have a joint replacement.